Welcome to this lecture on the health of vulnerable worker populations. My name is Dr. Lesliam Quirós-Alcalá, and this lecture entails a brief overview of how the workplace may impact health and provide examples of unique vulnerable worker populations. Here are the learning objectives for this lecture. In this section, we will talk about work as a social determinant of health. So why does work matter? Well, work is a social determinant of health that can impact health disparities. According to the World Health Organization, social determinants of health are defined as the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. Social determinants of health include socioeconomic status, or SES, neighborhood and physical environment, social support networks, access to healthcare, experiences of discrimination and racism, as well as working conditions. These are all factors that influence our health and well-being. Work is a multifaceted construct which operates as a social determinant of health. It provides a source of income. It also provides a means by which someone may access health insurance and access proper health care. It is also linked with occupational status, prestige, and segregation, where occupational segregation refers to when one demographic group is overrepresented or underrepresented among different kinds of work or different types of jobs. Work is also associated with conditions and exposures which can impact health. It can provide work-related benefits as well as impact social support networks. For example, some immigrant workers may experience isolation, and in turn, this may impact their mental health. It is also recognized that structural racism and discrimination may underlie the unequal distribution of these factors, which can impact health. According to the National Institutes of Minority Health and Health Disparities, structural racism and discrimination refers to macro-level conditions such as residential segregation and institutional policies, including those at the workplace, that limit opportunities, resources, power, and well-being of individuals and populations based on race, ethnicity, and other statuses, including but not limited to the ones you see here. Structural racism, also sometimes referred to as systemic racism, encompasses systems that reinforce and perpetuate racial discrimination. For example, while housing, education, employment, and healthcare access individually can be referred to as risk factors for adverse health outcomes, the interplay between all of these is structural racism. This structure has unfortunately led to disproportionate exposures and environmental injustices observed among marginalized populations, including vulnerable worker populations. So how are these workplace-related factors related to health? Well, for example, a US national study found that higher occupational prestige was associated with better self-rated health after accounting for socioeconomic status, job strain, support, and satisfaction. While another study reported that working in an occupation with a higher proportion of immigrants is associated with a higher odds of poor physical and psychological health. Work conditions, including workplace discrimination and precarious work, are also linked to poor mental health and alcohol use. Additionally, exposures at the workplace, including chemical exposures, can increase health risk, and it is often vulnerable populations, including low-income populations of color, who have the most dangerous jobs, exposing them to higher exposures to many chemicals and other workplace risk factors. Many workplace hazards have been associated with an increased risk of cardiovascular disease, including exposure to different chemicals, as well as excessive heat or cold, noise, and physical exertion. In terms of work-related benefits, research has also shown that greater job flexibility is associated with less self-reported stress and strain, as well as better physical health, and that lack of paid sick leave is associated with lower use of recommended cancer screening services and a higher likelihood of workplace injuries. So how can work be linked with health disparities? Well, research shows that workplace resources and exposures can impact health. Occupational segregation is also prevalent in the United States labor force, with increased workplace risks and poor health outcomes observed among people of color, those who are low income, and immigrants who tend to take on precarious and dangerous jobs. In addition, disparities in access to work policies and benefits that are beneficial to workers are prevalent. There are also disparities in workplace exposures. This includes exposures to physical, chemical, biological, safety hazards, and psychosocial stressors. As noted earlier, structural racism and discrimination may be a key mechanism through which work can contribute to health disparities. Notably, work is amenable to intervention as exposures and conditions that place workers at risk can be mitigated to ensure that every worker goes home safely. Now, some of the mechanisms and pathways by which work is linked to health disparities may include occupational segregation, which we covered earlier, in addition to worksite segregation, which is when there is an uneven distribution within the workplace based on select demographic characteristics such as race and ethnicity, gender, and immigration status. There may also be intergeneration transmission, sometimes referred to as an intergenerational drag. This occurs when ethnic or racial groups pass social assets and liabilities from one generation to the next. For example, racist actions and inequities experienced by one generation may be felt across subsequent generations. Seemingly inexplicable disadvantages that persist across conditions, subpopulations, and time may be attributable to historical traumas. Intergenerational transmission or drag views contemporary disparities as the cumulative effects of macro-level systems interacting with one another in ways that generate and sustain racial inequalities. Other mechanisms and pathways linking work to health disparities include upstream policies at several levels, including the workplace organization level, as well as workers' compensation policies and others. In addition, lack of regulatory enforcement of workplace safety regulations at the federal level and loopholes that do not allow for workplaces to be inspected and monitored to ensure worker health and safety. And lastly, system-level trends, including increases in precarious jobs, recessions, which lead to increases in job loss and unemployment, demise of labor unions, which fight for worker health and safety and better wages, as well as globalization of production and deregulation of markets, increases in the number of immigrant workers, and the impact of pandemics and natural disasters, which lead to disparate exposures among essential workers.